Welcome back to Research Connection. Joining me today is Dr. Teresa DeFrancesco and Dr. Chris McLaughlin. Hello.
Hello.
Hi there.
So let's start with a little bit about yourselves.
All right, since I'm older, I will start. I'm Terry DeFrancesco. I'm a cardiologist and a trained ECC clinician as well. I've been here almost 30 years. Did both of my residencies here at NC State.
And I'm Chris McLaughlin. I'm also a criticalist originally. I practiced in private practice after doing a residency here that I finished in 2016, and now I'm back as a cardiology resident.
Neat. And where are you guys right now?
We're in the small animal emergency room.
And you're going to talk us through a recent grant you both collaborated on.
Yeah, this is, we thought we'd record this in the emergency room because this is a clinical study funded by the ACVIM. And we're looking at the role of point-of-care ultrasound, not only in the diagnosis. We've already proven that it's helpful in the diagnosis of congestive heart failure, but more so in the management of congestive heart failure. Specifically, we're looking at the resolution of a lung ultrasound artifact called B lines. These are these kind of linear streaks that you see when you're imaging lungs that are full of water, pulmonary edema specifically. And these artifacts, we can see them go away as we're treating the animals with Lasix, but we need to know a little bit more information about them so that we can use those findings more appropriately and specifically also compare them to physical exam findings. So I'll let Chris tell you more about the specific aims of the study.
Sure. So this study kind of has two parts, essentially. So the first part, as Dr. DeFrancesco mentioned, is monitoring how B lines resolve in dogs that have been hospitalized and treated for left-sided congestive heart failure. You know, right now we rely on things like what we hear with our ears, our auscultation. Sometimes we also rely on how quickly the animals are breathing. But, you know, in a busy emergency room or ICU where things are loud, that can be a bit of a subjective assessment and sometimes can be tough. So looking for more objective, better data, you could take chest x-rays, but it's impractical to take the animals hourly for x-rays. It's costly and exposes everyone to ionizing radiation. So our goal is to see if we can demonstrate a pattern to how these B lines resolve so that we may have a more objective way of monitoring for resolution of pulmonary edema. And then also, there's been quite a move recently in human medicine to look at point-of-care ultrasound as kind of a visual stethoscope. So we're finding that what we can see with our eyes is probably more sensitive than what we can hear with our ears. So another part of this study is comparing what we see on ultrasound to what the emergency clinicians hear when they listen to these patients. And, you know, hopefully we'll be able to prove that this is a more sensitive test for monitoring for those changes.
That's pretty clever. Marrying old technology with new technology.
Yes,
yeah,
exactly.
The point-of-care ultrasound is really growing in veterinary medicine. The technology has become quite affordable, and it's good quality as well. So up to 50% of general practitioners in the state of North Carolina, and I would venture to say almost all emergency veterinary clinics now have a small compact unit like this, because it really does help in the management and timely diagnosis and treatment of animals with critical illness.
That's awesome. Well, thank you for sharing.
Yeah, you're very welcome. Thanks for your interest. Yeah.
Best of luck.
Thank you, Kyle.